Hey guys, Dr. Luke Stringer from Advanced Health Chiropractic down here in the South Loop of Chicago, and we're back talking about headaches and the causes of headache. And a really common question that we get in the office is, why do I have headaches, and why do my headaches keep coming back? So before we go exactly what's causing it, let's go over what we expect to see in terms of the spine and the anatomy of the spine, and then we'll go over how essentially we have shifts and how that essentially can create headaches. So when you evaluate a healthy spine, a cervical spine, your neck, you expect to see your ear be on top of your shoulder. You expect to see a nice even curve. We have that curve to displace the weight of your body evenly into the joint and the tissue. So when you have good weight displacement, balanced strength in the tissue, you can function without restriction. But in our previous videos that we've discussed poor posture and the soft tissue, and how that can essentially shift and become damaged can create headaches. So traumas, big traumas such as car accidents or what we tend to see repetitive stresses, the spine can shift out of alignment. When it shifts out of alignment, it puts stress and tension onto the joint, onto the tissue, the nerve. That can cause symptoms. This misalignment can also put stress and tension into the soft tissue. As we just discussed on a previous video, that soft tissue becomes weak and inflexible. But also what happens is we create something called a vertebral subluxation. And essentially, when you evaluate a healthy joint, what is a joint? You expect to see lower bone, upper bone, disc. A joint should be free in every plane of motion, unrestricted. It should be stable in its movement, it should be pain-free. But when we have those postural shifts, or we have weak tissue that stabilizes and moves the joint, a joint can simply shift out of alignment. And essentially when a joint shifts out of alignment, then you put stress and tension onto a nerve root. Well, the top two nerves in your cervical spine, C1 and C2, go back into your brain. So when you put stress and tension onto those nerve roots, you're going to get symptoms. Classically, it's going to be a headache or a migraine. So these vertebral subluxations are critically important to detect and correct, first of all for that short-term correction, but also for long-term correction. Essentially, if you don't address the functional aspect of the joint and get the joint back into alignment and free in motion, so it's not creating stress and tension on the nerve roots, doesn't matter how much stretching we're doing, how many NSAIDs we're taking, how many shots we get, if you're not addressing the root cause of the issue, the headache is going to continue coming back. And that's what we're going to discuss in some further videos, how we can diagnose and correct the root cause of the issue. So if you're suffering with headaches, family member, co-worker, friend, or they've tried many forms of treatment and they're struggling to get them corrected, we encourage them to click the button below, fill out the contact form, take care of the $39 offer. We look forward to seeing you in the office, diagnosing your issue and going over some treatment recommendations to get it corrected without the use of drugs and surgery. See you on the next one.